I was shocked. Of course, what triggered in my mind was, this is a cancerous lump.
Yeah.
So I had to find ways of getting the lump out of my body. So I had to call a cousin who was a doctor, and I visited him in Machakos General, and I did the lumpectomy and took the lump to the lab. Of course, when you hear the word cancer, the first thing that appears in your mind is death.
Death, yeah.
So of course, I had a child who was joining Form 2, and I took the child to school in Nyanza. So it was like, to me, I was running away from the reality. I had to stay there for some time.
Right.
Until one day, I decided, no, let me do a self-check again on me, on the same breast. So when I squeezed the breast, what came out was a pus, a reddish pus.
Yeah.
I knew automatically I'm gone.
Yeah, I can imagine.
So I didn't tell my mom. I ran back to Nairobi to go and collect my results in Machakos, which at that time I didn't still go. I was still in denial.
Yeah, yeah.
I stayed again the month of February and March. We went for the voting.
Yeah.
There was a petition, of course, and I said that this is the right time to go to town, being there were, I assumed to me that there were chaos in town.
Okay, okay.
So I wanted to go inside so that I can get a gunshot and die and not anything of cancer in me. But apparently things were smooth in town, things were running so well. So I had to go and collect my results. I took it to the doctor, who later on disclosed for me that it's a cancerous lump.
Okay. Yeah. All right. So we'll catch up in terms of your journey in just a moment. And I mean, here you are now, even just listening to how hard it was for you to accept it. It takes a lot for you to hear that kind of news. And Benda, roping you in at this particular point, what reasons do you believe actually influence women's utilization of these cancer screenings? Why do you think we don't go, and get these early detections?
I think Celesta has spoken into it, Shiko.
Yeah.
She mentioned the fear that people assume cancer means death sentence.
Yeah.
And fear can either cripple someone or make someone want to take chances to be able to discover early. And because breast cancer, cervical cancer, other cancers are not things that you feel pain before the signs and symptoms often.
Yeah.
People will be like, I'm fine, my body is okay. Why should I go and find that which I don't know yet?
Yeah.
Sort of in denial. I do not want to find out. And until the body starts screaming at you.
Right.
When the pain, when the pus, when the lump is big, that's when people seek attention. But secondly, there is also the fear of the cost of cancer treatment.
Right.
Often, many people don't know that the earlier we discover cancer, the easier it will be to treat, the cheaper it will be to treat, and even the chances of recovery will be improved tremendously if somebody discovers early. When you wait, when they don't go for the screening, when the signs and symptoms start showing, when we get to stage 3 and stage 4, that's when the cost is phenomenal. That's when the doctors are working towards managing the disease as opposed to treating for cure. And that's when we also have the challenge of finances because it's expensive.
It is.
Yeah.
It is. It is.
So that's the second reason. And the third one is access.
Yeah.
Now imagine a woman who is living in the village, she's found a breast lump, she's felt something in her breast, and she's thinking, where do I go?
Yeah.
Access to the clinic at the local level, chances are the doctor there may not be able to diagnose because they don't have the facilities to be able to properly diagnose. So they will send her to some center, which is a bit far off removed. Remember, this woman is not having pain yet. So at this point in time, it's something in the breast, not known whether it is cancer or not. And she has so much else to deal with. That barrier to access becomes a policy issue because the easier it is for a woman to go to the facility and get diagnosed as early as possible and treated as early as possible, the easier people will start seeing cancer as treatable as opposed to what we see right now, which is a death sentence.
And it's interesting also that when you talk about some of the reasons why women will actually not go for their screening, even doctor, you can even add on to this, are things like religious practices. And, when you think about the norms that we have. For example, there are Muslim women who are discouraged from even going to see their doctor or for screening especially if there is a male practitioner. So these are some of the things that we need to, you know, demystify as far as accessing healthcare is concerned.
Very true.
Yeah.
Very true.
I hope it is changing. We have to start somewhere.
Yeah.
And we are here today to discuss it. We are here today to spread the awareness. We are here today to say, yes, early detection saves lives.
Yeah.
Early detection helps. Early detection helps us treating the tumor, the cancer, any cancer, including breast cancer, because it's one of the most common cancers.
Yeah.
And I think more we talk about it, more you help us spreading the information. It's very important, because indeed the biggest problem, I think, is we don't want to talk about it. It used to be taboo. It
Yeah.
was like,
Yes.
oh no, there is something,
Yeah.
let's not mention anything.
Very
There
true.
is many ladies I see, because usually it's ladies who come with the breast problems.
Right.
They come, and before they come, they are really worried about, indeed, the expenses. They are worried, oh, I will go to see a doctor, he or she will amputate my breast, and then
Yeah.
I will die.
Yeah.
And unfortunately, and Benda was right, unfortunately, very often in Kenya, it's true, because the patients come at the very, very
The tail
latest
end,
possible
right.
stage.
Yeah. And, you know, there are always this perception, about screening. Can you really define what a mammogram is for those who aren't sure what it is? It can be a very scary thought.
Mammogram is an X-ray. Mammograms were invented in 1960s. And indeed, in 1960s, mammograms were quite heavy machines.
Yeah.
So sometimes when you talk to ladies, sometimes when you talk to some doctors even, who started practicing in 1960s, they say, oh, mammograms are heavy and the mammogram is painful and so on.
Yeah.
No, mammogram doesn't have to be painful. Mammograms, the modern mammograms we have, they are digital mammograms.
Yeah.
There is some X-ray exposure, but it's minimal. And now we know that the risk and balance, or let's say the benefit and benefit and risk balance
Yeah.
is on the benefit side. Mammogram once a year, and here in Kenya, the recommended screening mammograms, we start at the age of 40, once a year up to the age of 54. And we know that those screening mammograms
Yeah.
can detect, and especially if mammograms are done regularly, can detect cancer 3, maybe even 4 years before it becomes a lump,
Yeah.
before it shows itself with symptoms. That's why
Wow,
we call
that's
it
remarkable.
screening.
Yeah.
And this is the point. We can cure cancer completely. Very often it needs a bit of surgery and maybe some kind of radiotherapy. We can keep the breast. We can
Right.
save the breast.
can save the breast,
Very
yeah.
often we don't need chemotherapy. So what Benda said is very correct. It's,
Right.
if we detect it early, we can cure it, most important, and the treatment doesn't have to be expensive.
Right.
I have patients in the UK. I came to Kenya from the UK. I have patients who were treated with breast cancer, 20 or 30 years ago,
Yeah.
which means, yes, we cured
Yeah.
it,
We
and we
did
can
cure
do
it.
it here.
Right.
But yes, screening,
Early.
early detection is, that's the message to take home.
That's the message. Okay. As we, yes,
Let
you
me
want to
add
add on to that.
something. Early detection coupled with timely treatment.
Yes.
And I'll qualify that. There are women who will find the lump or find some sign and symptom
Yeah.
and keep it to themselves for a period of time. They will then be knowing something is going on in my body,
Right.
but because they've not sought treatment as early as possible, we cannot help that situation.
Yeah.
And therefore, early detection coupled with timely treatment
And
is what will
awareness.
save.
Is what
And
we're saying.
awareness.
And that's about awareness. Yes,
Right.
yes, that's
right.
correct.
Okay.
Yeah.
So it's not enough to just know that there's something wrong. You have got to have the timely treatment that goes with it.
Absolutely.
Okay.
And fear should not be a factor here. Yes, there is the fear of what will they find.
Yeah.
But if they find it early and they treat early,
Yeah.
it will be so much easier to manage. We are talking about life and death here. We're talking about the protracted treatment options that he's mentioned. We're also talking about the emotional trauma that comes with cancer.
Right.
Imagine knowing something is inside my body,
Yeah.
it's hurting me, but I'm sticking with it and not telling anyone.
Right.
How that does to the body.
It does.
As opposed to,
Yeah.
I know something is happening, I go tomorrow, get checked, I'm told it could be cancer, it might not be cancer, because no surety, not every lump is a breast cancer lump.
Yeah.
So you're told it is cancer, we will deal with it, we'll treat it, you'll be fine. And that's why you find 20 years, 30 years of survivorship in developed nations, because they take action for early treatment, as opposed to here, where somebody will have visited. I heard from a doctor the other day that a woman will have visited about 7 physicians before they actually take the step to get treated. Probably because the first ones that they visited were the wrong ones. And they're also
hoping for a negative result. You know, it's like you do not, so you keep trying to check for different opinions. You seek a second opinion, a third opinion, hoping that the previous physicians were all wrong. Which is where the problem is. And
I don't blame the woman. On this one, it's also us in the community addressing our stigmatization of cancer. Okay? Where we create awareness that it's not a death sentence, that people are living and thriving with cancer, with treatment of cancer, that it is possible to beat cancer early. Okay? So that we're not stigmatizing the woman for her to feel I have to hide it, that we are talking about it. Shiko, when I started advocacy, if I mentioned the word breast on TV, there would be a bleep. A beep. But that's what we're doing today. Thank God for that.
It's not happening today.
It's not happening today. And in fact, we actually do have text messages already streaming in. We want to remind you the question of the day, dear viewer. If you are watching us at home and you do have something that you'd like to request or, you know, ask for, know more about, why don't you start texting us, but still contribute to what we have for you today, which is all about providing solutions. And we ask, how do you provide the gaps towards the treatment and management of cancer, and cancer such as breast cancer for that matter? Well, as we of course take a look at that and receive your text messages, let's see who's talking to us very quickly. It says, hi, it's Kaka Dani from Mombasa. My question is breast cancer a genetically thing? Okay. All right. And then I understand that we've got a phone call. Good morning.
Good morning.
Yes, hi. Who are we speaking to?
I'm Mary from Golkalau.
Yes, Mary. Karibu sana.
Nilikuwa nauliza yangu si kuhusiana na breast cancer. Ni kuhusiana na huko chini sasa kuna venye nilikuwa nimeambiwa nilikuwa natoka uchafu ya yero huko chini sehemu nyeti. Na kumaumwa na tumbo hivi. Sasa venye nienda nikatoa dawa hazifanyi kazi. Dawa zenye nilipewa uchafu ikaacha kutoka. Lakini saa uchafu nini bado tumbo inaniuma asubuhi. Sasa nilikuwa nashindwa labda naweza enda kufanywa diagnosis ama naweza fanya nini?
Okay, sawa. Tutakujibu very shortly. Thank you, Mary, for that. Okay, all right. So first of all, we've talked about, or at least the question that came in is whether or not it's genetically
it's related to genes.
Yes, right. Related to your genes, rather, Daktari. And that particular question, of course, they didn't leave their name. But what would you respond to that?
Breast cancer, like many cancers, happen very often we don't know the reason. Let's say if I can stress, every one of us, every human being, every animal, every day, 3 of us sitting here, we have a few mutated cells right now. And these mutated cells, fortunately, our bodies have system. It's like a red light system. Red light, stop, you are mutated, you have to die. For some reason, which we don't fully understand because there are so many different pathways, the red light doesn't go on, or maybe the cells skip the red light. And this is when cancer starts growing. So the question is breast cancer related to the genes? 10%. We can prove right now that 10% of breast cancer indeed runs in the family, which means it's the grandmother, mother. There are gene mutations called BRCA1, BRCA2, TP53. But 90% of breast cancers run, we don't know, there is no family history. And that's why it's very important to remember, yes, of course, with family history, the risk is higher, because the risk sometimes could be 90%. So the question is, if my grandma had cancer, my mother had cancer, the question is not, am I going to have cancer? Very often the question is, when am I going to get the cancer? But 90%, so 9 out of 10 patients diagnosed with cancer have no family history.
And this is the thing. So on the flip side, you can't also say because no one has had a history of cancer in my family, I'm not going to get cancer. Okay, so we understand genes definitely a risk factor when it comes to, of course, getting cancer. Very quickly before we take a commercial break, Benda, because I understand we have 1 minute, would you like to address Mary from Olkalau, who is probably hinting towards cervical cancer, talking about discharge and is asking, should I go for a screening? I think it all ties in if we're talking about cancers.
So for Mary, my advice would be go and ask for a pap smear. Okay, so that we know what is causing that discharge and what is causing that pain. Often for women, we ignore the signs and symptoms. And at that time, if it is caught early, cervical cancer is 100% treatable and 100% curable if discovered early. It could also be an infection that requires a different intervention. It could also be some hormonal reaction to her body. So we're not saying right now it's cancer. However, it is important she goes and seeks that opinion. And I'm not calling it a second opinion because what was treated for before was the discharge, and she's saying the discharge has lessened, but the pain is still there. Pain in the body is not normal. It's your body telling you there is something happening.
Wow, very important.
Go get checked, Mary, and I wish you well.
All right, we want to take a short commercial break. When we get back, there's so much in store for you, including a self-breast examination. Benda is going to be showing us how you can actually look out for abnormalities right in your home and know whether or not you definitely need to actually seek for medical help, okay? So when we get back, we will be taking more of your questions right here on the show. Please keep them coming. Remember, at K24 TV is how you can reach us. Daktari is here on set to answer any questions you may have, and of course what more we can do to support survivors. Will be back in just a moment. All right, welcome back to Health and Wellness. This morning, it's all about breast cancer awareness. My name is Shiko Kaitani, still in studio with Dr. Marek, Benda, as well as Celessa, as we continue to support and show our love for survivors, those who are going through their battle as we speak. What more can we do for them? It's all about survivorship today, and early detection is really what we are here to talk about. Most importantly, do you know how to look out for abnormalities in your breast, ladies and gentlemen as well?
Yes.
Okay, so we're here obviously because we actually do want to demonstrate how you can go about checking your breasts at home. Don't look at it as, of course, explicit content, but rather useful information. Okay, so some people might be wondering, okay, why would you actually demonstrate? But it's important.
Very.
Because the truth is, what position is right? How do I go about it? What kind of movements do I use around my breasts in order to actually spot those abnormalities, right? Okay, so Benda, take it away. What are we doing?
Okay, so I'll request the doctor to walk us through the how you do it as I demonstrate.
Okay.
I'm holding a prosthetic.
Right.
Yeah, here, which is a mold of a breast. So what I will be showing is how to do it.
Yeah.
And ladies, when you're checking, men, when you're checking, please remember it's so much more from the top all the way to the under the breast. Yeah. So this is the breast that we're going to be demonstrating
It is
with.
very important
Yes.
for you ladies and for your partners to know your breasts.
Yes.
You know your breasts better than anybody else.
Right.
Breasts should be examined. It's very important to examine once every month, once every 2 months, maybe even every 3 months.
Right.
But after your period. The best time to examine your breast is probably 4th, maybe 5th day of your period.
Right.
Now, very important is to understand what it looks like. So the first step always is in front of a mirror.
Like this.
Make sure that you see your breasts. Is everything normal? Left,
Right.
right, do they look the same? Then your arms are going up. Is everything okay? Do they
Right.
go up the same way? Is there anything pulling down? Is there anything different? Is the nipple okay? Is the nipple at the same level?
Right.
So this is always the first step. Then we go to the breast.
Okay.
And indeed, with flat fingers, there are many different schools, many different ways, but most important is, and Benda mentioned it,
Yeah.
it's important to examine the breast from the inframammary fold
Okay.
all the way up to the collarbone. Because
Right.
breast tissue could be up to the collarbone and
Yeah.
even in the armpit.
So what is the motion that I'm using? Is it from the top going
There are
side?
different schools.
Yeah.
And probably, for me, easiest to remember, and I've been doing it, not on me, but with my patients
Yes.
for last 15 years,
Yeah.
I start with the nipple.
Okay.
Gently start with the nipple, very gentle pinch. Is there anything behind the nipple? Because
Right.
sometimes there could be some fluids, there
Right.
could be nipple problem, nipple pulled in.
Yeah.
So then at least we know, is everything okay?
With the arm up as well.
With the arm up
Okay.
or with the arm down.
Okay.
With ptotic breasts, usually what we do, ptotic meaning slightly
Lower.
lower breasts, we put left hand underneath the left breast, and with the right hand, let's start with the nipple,
Right.
There.
okay?
Yes.
Gently, is everything okay? Then just the nipple itself, flat fingers, 2 or 3, flat. Please
Right.
don't do this.
Yeah.
It's very important. Very often we see ladies doing, oh,
Yeah,
I
that's
have
a bit
lumps.
too aggressive,
These are
yes.
your ribs, yes, indeed.
Yeah.
Yeah.
You start with the nipple, and then you can go left, right, up, down. There are many schools. I like the clock.
Okay.
So I follow the clock. 12 o'clock, gently all the way up to the collarbone.
Right.
Then 1 o'clock, 2 o'clock, 3 o'clock, all the way around the clock.
I like that. Think of the clock.
Okay, so
Okay.
then it's much easier to remember. It's
Right.
much easier to not to miss any part. And breast tissue can
Yeah.
go all the way up to the
To the
armpits.
armpits.
Yeah.
And it does happen very often that the breast is fine. We cannot feel anything within the breast, but
Right.
there is a lump in the armpit.
Right. And sometimes, how would you know the difference between your breast tissue and that lump? Like, how do I know it's definitely a lump?
I always ask my patients,
Yeah.
my friends, my family, do a homework.
Yeah.
The breasts will change every week because of the hormonal cycle.
Okay.
The breast will feel different today and it will feel different after the period.
Right.
So very important is to know your breast, and the homework would be do the examination once a week for about 6 weeks. So it's 1 cycle and a bit.
Yeah.
Then after the period, breast and all the breast lobules, and there should be up to 27 breast lobules, so it may not be easy. Sometimes we say the breasts are lumpy.
Yeah.
To understand, to know your lumps, then it's easier to say, oh, there is something different. I can't remember this lump.
Right.
So this is when you notice, okay, this is
Yeah.
not my breast. This is something different.
Okay, and Benda, I mean, even just speaking to women, because Dr. said something very interesting. How many of us actually know our bodies? Do we pay attention to our bodies?
That's the question.
Yeah.
And you see, knowing your body is about knowing what changes are happening when.
Right.
For example, when the doctor says stand straight, you ought to know, how do my boobs look like when I stand straight?
In front of
Obviously, it has to be without the bra.
Right.
Because bras are hiding something. So you're standing straight to see. When you say move it up, some of us are blessed with two boobs that look alike.
Right.
Some people have one that's different from the other. As gravity works on us, they tend to start going some other direction.
Right.
So it will not always be straight.
Yeah.
And therefore, as they are going downwards, you also ought to know what's my normal.
Yeah.
So that the day you lift your hands up to say, I'm checking what the movement is,
Right.
you will know. If one is sluggish, that's what we call it, sluggish, you will know that slug is because something could be weighing it down.
Right.
Yeah, something could
Right.
be holding it down. It won't be, wait a minute, my boob, left goes up, right goes down, I'm okay, and you've never checked yourself before.
Right.
Know you're normal, so that when the abnormal comes, you will not need to be told this is abnormal.
Okay.
Yes.
Does this apply to the men in terms of doing at least a self-check, Dr.
Men, breast cancer happens to men, and it's a very important message that 1 in 100 cancers diagnosed are men. Now, usually gentlemen come with a lump, and it's could be smaller, could be bigger lump just behind the nipple. Some patients, some gentlemen with breast cancer come with leaking nipple, and it could be blood or clear water-like fluid.
Yeah.
But yes, of course, it's also very important for us to make sure, oh, is everything okay? Is there anything? Because we have to find this lump somehow.
Right.
Very common problem in men is something we call gynecomastia. It's the men boobs.
Yeah.
It's slightly, it comes with time. Very often it happens to very young gentlemen, teenagers. When they grow, there is some hormonal imbalance. It may happen later, especially after some medication. So men, and it's unfortunate, it's the civilization. We grow boobs sometimes. And it's important to understand, okay, is everything okay? Is there anything harder, different?
All right, so we're speaking to the men as well, that yes, indeed, you do have breasts.
Yes.
That's number one.
Yes.
And men do get breast cancer as well.
And
so,
it is more lethal.
Yes.
Because there is less fatty tissue to hide the lump, to hold the lump. So it goes directly to the muscle and directly to the bloodstream.
And very important is we just don't think that men can get breast cancer. That's why it's usually detected very late.
Yeah. All right, and I like that bit, the fact that even your partner should also be part of this particular conversation. You want to speak to partners as well?
We heard from our survivors saying that it's my husband. Yes, gentlemen, it's very important. You know your wives, you know your partners, and it's very important. If you notice anything, please send them for screening, send them to breast clinic for investigation.
Yeah.
It's very important, gentlemen, you have your mothers, sisters, just send them for screening, because it's October, it's Breast Cancer Awareness Month. This is the time we remember about it, but we should be doing every day, all year long.
Okay. And even as we take our positions back on, of course, the podium, we do have some text that we want to share with you. If my director can actually slap that up on the screen, and this would probably prompt you to seek medical evaluation. Let's share it with you very quickly, even as we approach our seats. There are early signs of breast cancer that may include a new lump or change in the breast. Let's take a look at another sign that you need to look out for. There's something else here that says a nipple inversion could be suggesting something more is happening. And then we've got another tip here for you that we want you to keep in mind, is that areas of significant irritation or redness is something that could also be a huge red flag, an indicator. And then we've got dimpling or thickening of the breast skin. That is also another huge indicator for you. And then persistent breast pain or discomfort is also another sign that you definitely need to go for an evaluation.
Add to that a discharge on the nipple.
Yeah.
Or the nipple turning on the inside. Okay?
Yes,
so don't
you
ignore the
mentioned
nipple area, it's part of the breast.
Yeah.
And if you've not been breastfeeding, you're not breastfeeding, or if you're breastfeeding and the milk that's coming out is reddish, you should get checked as well.
Right.
It could be an infection or it could be something.
Okay.
Yes.
Basically, I think the message we are trying to send now is anything new, anything different.
Yeah.
Very often it's the nipple which is the window which is showing us, okay, there is something wrong going on. There is something inside the breast.
Okay.
And it could be inverted nipple, it could be leaking nipple, it could be nipple which looks a bit crusty, like eczema.
Yes.
It could be any skin change.
Yeah.
Sometimes, and it happened to me, I had a few patients with something looking just like a mosquito bite.
Oh, wow.
And it was a very early cancer. By the time we diagnosed and by the time we had results, so it's usually about 2 weeks, the breast was red hot swollen.
Oh, my. Yeah.
Don't wait for pain, please. Pain is very rare. Breast cancer, like many other cancers, like cervical cancer, come without pain. They come silently.
Very slowly.
And pain happens usually when lump or cancer is big enough to invade muscle, nerve. So don't wait for pain. Yes, it could be anything new, and it could be pain. It's better to have it investigated.
Early enough. Okay. Yes. Let's talk to Celesta for a bit. I hope you haven't felt forgotten, my dear, but thanks a lot for staying with us. Let's talk a little bit about, you know, the psychological impact that this disease has had on you and how you have managed to cope and just prepare yourself to actually handle breast cancer. Can you tell us a little bit about that?
Of course, the mention of cancer affects one's psychology.
Yeah.
When especially you flash back to your children, your life, and maybe life after your death, it really brings a great impact on your body. It brings someone's strength down, but as for me, I had to just pull myself up, consider I have 2 children and 2 adopted. I had to try and work it and fight it and put it down. At times you have to talk to your mind, talk to your self-being, and say, this is me, I'm battling this, but you'll not put me down. I have to put you down.
Yeah.
Yeah.
Wow. And Benda, just to add on that, a lot of women who go through breast cancer surgeries have their breasts removed.
Correct.
I mean, are dealing with body image difficulties. And you can imagine as a woman not having them. I mean, it changes everything for you.
It does in a way. However, if you look at the benefit of why you're losing that breast, it is so much more empowering to think about, I'm taking steps to preserve all of me.
Right.
So a woman is not just breasts.
Right.
Okay? A woman is the awesomeness in the brain, the awesomeness in the body, the awesomeness in the persona, and the spiritual as well. So the breast is just one component of a woman.
Right.
And that is why to deal with stigma, that a woman who has had her breast removed is actually taking measures to make sure her quality of life is not affected. That becomes empowering as opposed to you're losing a breast.
Yeah.
And the other thing is, the reason we brought this here is to show there are mechanisms to cope. This is a prosthesis.
Yeah.
If a woman wears it under the bra, in the bra, somebody can never tell. If you touch it, it feels like a real boob.
It really does,
So
actually.
really, there is no need to stigmatize the woman.
Okay.
And because there are mechanisms, I had brought one with wool.
Yeah.
The one Dr. was touching. These are actually knit by women here in Kenya. And again, it's something that she can do as a hobby to remind herself that I'm fearfully and wonderfully made.
Amen.
I am beautiful.
Yes, that's
breast or no breast, I am me. I am enough.
okay. So as
I need to butt in here just to say just my 2 pennies. Very often with breast cancer, we can preserve the breast.
Yeah.
It depends. There are only a few situations when mastectomy is the best, the safest way. Unfortunately, because the presentation very often is late, mastectomy could, or let's say sometimes, is the only option. But up to 80% of breast cancers in Europe, in Western world, are treated with breast conservation. We can keep the breast, it's safe.
Yeah.
It's only some cancers which are not safe. With some cancers, it's not safe to keep the breast. So this is my, let's say, message number 1.
Yeah.
Early detection allows us to keep the breast. Now, message number 2 is that removing the breast, it's not the end of the world.
Right.
We can deal with it. We can deal with it with prosthesis. We can deal with from surgical point of view. We can rebuild the breast, and there are many different options. And the surgical techniques are available here in Kenya. We can do it. We can use simple implant or some, you know, your autologous tissue. Every one of us has a bit of tissue here or there or somewhere else.
To rebuild
the breast. So we can we can deal
well,
with
that's
it.
some promising news right there. And, you know, at least giving people hope that there are solutions on how to manage and cope. But speaking about what you're saying on our social media platforms, in particular WhatsApp, let's see what our viewers have to say or are asking. Morning K24, kindly, I got a concern on cancer. Which cancers are genetic? And I got someone with liver cancer but has spread to the liver, ovaries. What treatment do you advise? The problem is the patient is not able to feed. Wow, very complicated situation. Okay, let's hope you know, our panelists will be able to handle that. Hi, I'm Ida Shiko. I have a question. Kutoko kwa ngozi on the nipple, and it's so painful. Could it be a sign of this? I think we just answered that as well, right? So we're talking about discharge in her particular case. And there's some discoloration. That's what she means, Daktari. Hi, Shiko. My breast produced some discharge, which is sometimes whitish and sometimes clear when pressed. I have not given birth nor aborted. Is this alarming? Wow.
Breast discharge, and especially if it's both breasts, and especially if it's after breastfeeding, or let's say after being pregnant, it's normal. We call it physiological. And sometimes it could be annoying because it's staining your bra. Breast discharge, we are worried about breast discharge when it's one side, one breast, when it's when it happens without any stimulation, when it's bloody, red blood, or clear. But I would say the message here is that yes, most probably there is nothing to worry about, but breast discharge could be one of the symptoms of breast cancer, and it is safer to investigate.
Right. How would you actually answer this this particular question in regards to someone who is preparing to have a child and now is dealing with the potential risk of breast cancer? How do you deal with that?
But breast cancer may happen in pregnancy. One of my patients, youngest patient, was 29, first pregnancy. She was almost 3 months pregnant, came with a lump which was cancer.
Oh, yeah.
It's not common, but it does happen. That's why it is very important to be breast aware. And although pregnant ladies' breasts are very difficult to examine because the breasts are changing, they feel different, they are lumpy, but it is very important to make sure that we investigate before pregnancy, or even if anything happens during pregnancy. It is important to investigate.
Okay, all right. Daisy, I believe from Eldoret, is on the line. Okay.
Yes, I'm Daisy Kiri from Eldoret.
Yes, Daisy, thank you for calling. You have a question? Do you have a comment?
I have a question.
Yeah.
Niko na rafiki yangu anaitwa Joy. So from last year, alidevelop kitu from the nipple. Iko karibu na nipple. Kuna kitu kimedevelop kama ukishika hivi kimeanza kudevelop kadogo, si kubwa aina pain. Is it cancer ama ni nini?
Okay, thank you so much for that. Okay, sawa. Tutakujibu in just a second. Daisy, talking about some of the signs that we've been discussing here, saying how her friend found a lump just by the nipple, but again, no presentation of pain. No pain.
And the question is, after she's discovered it, has she only talked to her friend, or has she gone to seek medical attention?
And this is the
because
problem,
as women, we need to advise our friends. It's good for you to tell me, and we'll pray about it. But guess what? There is a place for science as well. And science is know with surety what are we dealing with. So that even as we are praying on sureties. Okay? So please, let her go get checked. If she hasn't already done so. If she has gone and gotten checked and she's not comfortable with what she's been told, probably she's been given some medicine and told it will go away and it hasn't gone away, go back to hospital. Don't wait. You know? It could mean the difference between the treatment, like the doctor said, preservation of the breast, or even the invasiveness of the treatment that will come. We're not saying it's cancer. It could be anything. But get it investigated.
Yes. Early detection, early diagnosis may change things.
Right. Okay, more WhatsApps are coming in. My director tells me let's take a look at them before we start to wind down this conversation. Someone says, good morning, Shiko. Is it normal having pain on one breast during fertility window, mostly during ovulation, and some pimples around the nipples? Good question. Okay, keep that in mind, Daktari. Let's take a look at another one. Hi, my name is Julian. I have left breast pain for 4 years and recently did a DNA test which came negative cancerous. Okay, that came out negative. The problem is that even if I take anti-inflammatory drugs, rather, the pain is still there and I can't lean on anything because of the pain. Please advise. Okay, let's take those two so that Dr. can answer, and then now we can get back to the others.
Pain is a very common problem. Unfortunately, breast pain, because it's a common problem, has so many different causes, and very often it's very difficult to understand what causes it. But usually it's some hormonal cycle, it's hormonal ups and downs. Sometimes it could be muscle. There is a big muscle called pec major, just behind the breast. And sometimes when we use it, I don't know, play squash or tennis, it's the muscle ache which may be radiating towards the breast. I would say, if there is a problem for a few years, you mentioned 4 years, please have it investigated. Depending on your age, you may need a mammogram, maybe a mammogram and an ultrasound scan, or if you're a younger lady, an ultrasound scan. But it is important to understand, can we find an underlying problem which we can blame? Okay, so I would say, please see your doctor, and let's have it investigated, please.
Okay. All right. Getting back to you, Celesta. You know, as we talk about solutions, what can we do to make sure, you know, more women have access to education, screening? How can we support warriors, cancer warriors who are in the thick of it?
First, before I answer the question, I'll go back to the caller from Eldoret called Daisy.
Yeah.
I think she has fear in her. So the moment you still fear in you, you'll not even go for the mammogram.
Yeah.
So I would advise her not to keep on talking to neighbors, but instead advise the friend to go for a mammogram.
Yes.
Mammogram will give her the best results. Going to your question, I think the first thing we should have is community awareness. Because once someone is detected having cancer, you will find the neighbors talking ill about that person, and it will cause stigmatization to that person. So you find most people dying because of lack of knowledge, or you find others running away from the reality because of the reaction of the neighborhood. So what I would advise the community or the country as a whole, that we should first have community awareness or community education.
Right.
Let the people in the community have some knowledge about early detection. Early detection also saves life.
Okay.
As the doctor said before, that when you go for the early detection, it will also give you a clear picture of focusing on the good treatment. If only I went for that early detection, I couldn't have gone through the chemotherapy and the rest. But I think we are also suffering from ignorance, we as women.
Okay, thank you so much for that, Benda. This brings me to the point in terms of even what we know on the ground, as far as even insurance schemes are concerned. What do you think even needs to change? Policy changes right up your alley. What does this country need to do about breast cancer?
It's not just about breast cancer, Shiko. It's about cancer survivorship. It's about the treatment of cancer. It's about community awareness and education. I often ask myself what informed the policy that we have NHIF covering some element of treatment, but they are not ensuring the larger population that is paying remain healthier for longer. For example, if NHIF had a community outreach element, I know it's supposed to be National Hospital Insurance Fund, so it's in the hospital scenario, but if we had a community element to it, then we would have screening as a regular element for all women of reproductive age. We would catch the cancer so much earlier. We would have community outreach programs where women are being empowered with knowledge about breast cancer, early signs and symptoms. The government ought to take charge of educating its populace, because it will save the amount of money that is being spent.
It really does. So there's barely any input into prevention.
Very
important, just mentioned, is that both breast and cervical cancers, which are two biggest killers of women in East Africa, can be detected very early, can be detected before they become a problem.
Exactly.
It's mammogram for breast cancer, it's the pap smear for cervical cancer.
Right.
And we can detect the problem before it becomes an issue. An
Right.
issue meaning an invasive
Yeah,
carcinoma.
yeah. Okay.
It's equipping women with self-breast examination knowledge, flyers and pamphlets that
Yes.
can be distributed at the community level. It's integrating community health strategies that help women to understand better early detection so that they will not be afraid. People fear that which they are not familiar with.
Yeah.
The reason we fear cancer is because we've only seen the back end of the disease, which is
Yes,
death,
we know someone
which is
who has
late
died because of
diagnosis,
cancer.
which is chemotherapy, which is radiotherapy.
Yeah.
How about we start talking about survivors who were found at stage 0?
Yeah.
And they were treated, and they're now living quality life because it was discovered early. How about we empower survivors with knowledge and awareness and advocacy skills that they can go to the community and use it as lived experience to tell communities that, you know what, I am living proof. It can be prevented.
Yes.
Okay. Today, if a
And
woman
treated.
goes talking about, I am a breast cancer survivor, community shuns them. As opposed to the other way around, show me what you did, navigate me through this, so that you're walking me through the journey, we are empowered together.
Okay. So as we start to say, Kwaheri, let's give people options, solutions, what's happening this month. How can we take advantage, Daktari, of Breast Cancer Awareness Month?
It's October,
Yeah.
it's the Breast Cancer Awareness Month, and many hospitals, including MPSHA Hospital, I work for MPSHA Hospital, we have packages. We have packages for mammogram ultrasound scan for the screening, mammogram for ladies 40 plus, or mammogram for ladies 35 plus with some family history or with some previous problems, ultrasound scan, and it is much cheaper than ever.
Yeah.
It's much cheaper than ever just to encourage us to go for the screening.
Right.
It shouldn't happen only in November, but at least we have to start somewhere. So let's start in November, but let's continue next month and in December and next year.
Throughout. Yes, Benda, I'm sure you have very many
Two.
ideas. Yeah. Okay.
Two. I will not talk about the very many. Two.
Okay.
One.
Yes.
Let's talk about it.
Okay.
Let's talk about cancer as any other conversation we have on the dining table, we have in the supermarket, we have on the at the salon in the kinyozi. Let cancer be a conversation that we have so that we can remove the stigma, so that we can educate communities, so that we can take charge of our bodies.
Yeah.
That's the first.
Okay.
The second one is the hospitals are giving the subsidized rates. There are women who live below the dollar.
Yeah.
And so she's going to have to think, do I pay 1,000 shillings to get screened, or do I go and feed my children?
Right.
These are realities. And therefore the government needs to put policies in place that make screening a normal, that makes population-based screening. Screening is about before the disease projects, before the signs and symptoms come, creating an aware community that is rallying around prevention will be the solution. It's not about investing in so many chemo centers. It's about investing in community awareness.
Absolutely.
And we have mammogram machines not only in Nairobi, we have mammogram machines elsewhere in different countries, but they are
underutilized.
They are underutilized. We just don't use it.
Because again, there is lack of awareness. Okay.
And there is the fear, it's painful.
Yeah.
Daktari has said the machines we have today are not what used to be like an iron box that's pressing you. Today we have sensors that reach a certain point and they are able to be calibrated.
Right.
So the woman need not fear about pain.
Right.
You know, awareness,
And
education,
very important
community.
also is that the best time to have your screening mammogram is after your period.
Exactly.
At the same time, when the breasts are a bit softer, a bit more comfortable, they're not you know, full on annoying and tender. And just
Okay. Some really good points there. I don't know if we have any more text messages we can sample. Okay. All right, so with that being said, thanks a lot for engaging us as far as social media is concerned. We're going to have to bring this conversation to an end, but I know there's so much to actually discuss as far as breast cancer is concerned. Thank you for your questions. We are talking about early screening. Please take advantage, and most importantly, listen to what even Benda said. Can we talk about it so that it stops becoming taboo, so that we can get the awareness out there? And of course, proudly wear a pink ribbon, by the way, during the October month all throughout the year in support of those who are in the fight, those that we will be remembering who lost their battle to breast cancer. Unfortunately, let's keep them in our mind, okay? So that being said, a big thank you to Dr. Marek from MPSHA. Pass our greetings. Benda Kithaka, asanti sana. Of course, the Kilele Challenge is on social media in case you're actually going to be looking for her. Selesa, asanti sana for sharing your story with us. We love you. Asanti, asanti, asanti. And thanks for being with us. My name is Shiko Kaitani. Let me sign out and make way for the Daily Brief that's coming up next. Bye-bye.